name's Dr. David Shapiro. I'm with Complete Spine Solutions. We've got locations in Tucker. I just saw this posted on Facebook just the other day, and it really disturbed me. If I woke up and nothing hurt, I would think I was dead. Is that the way your life is? I've got to tell you, this thought was liked a bazillion times on Facebook. It's super popular. It's apparently the way so many people feel and function as they age. However, it's both a common reality, which is why so many people feel that way. It's also a limiting belief. In other words, it limits your potential. It's because people actually feel like this is the way it's supposed to be, and they think that that's normal. I'm here to tell you, it's really not. I have some new data for you. The most prestigious orthopedic journal in the world, it's called the Spine Journal, just published in May of 2017, the most advanced and largest study on low back pain ever. And here's what they found. They found that lower back pain patients, people who had lower back pain, tended to have straightened lower backs versus normal people. In other words, the straighter your lower back is, the more pain you'll probably feel. They found a couple of other things too, and that was that straightened lower backs also lead to disc degeneration. That's also known as spinal arthritis. In addition, it leads to disc bulging and herniation. It wrecks your discs. So what does all this mean? What's the point of this study, and what did it really prove? It really proved that structure matters. It makes a difference. We're in a gravity environment. How your spine is designed makes all the difference in how you feel, how much pain you have, and how you function. So what can you do about it? Well, there's a new reality. It's called chiropractic biophysics. Chiropractic biophysics has been improving structure in spines for over 30 years. It's the most published technique in chiropractic. In fact, there's more research in CBP, chiropractic biophysics, than every other technique in chiropractic combined. There's a proven track record of making a mechanical structural change in virtually every spine that we test. Here's what makes Complete Spine Solutions totally different than most other offices. Well, number one, we address your whole spine problem. We address your entire spine. Most offices really just focus on where it hurts. And I get that. I understand why people want. If they go in low back and have low back pain, the doctor looks only at the lower back because that's where it hurts. But I'm here to tell you, mechanics matter top to bottom. If you have a weakened foundation, it's going to affect everything. Guess what? If your neck is off to the side, it's going to alter the mechanics of the muscles, the soft tissue. Everything's going to be impacted below it. So top to bottom must be evaluated and analyzed to see if you've got a mechanical or structural problem. We prove our outcomes before we begin correction. There's no sense in trying to fix something that's not fixable. That's what we do. We test and we don't guess. We have specialized equipment that you won't find in any other chiropractic office around if they're not doing chiropractic biophysics. Our equipment has been researched and proven to make structural change to each and every area of the spine. We measure every angle, every vector of your spine using our digitizing software to make sure all of our exercises that we prescribe you are not only going to work, but they're customized for your specific spinal problem. Just like we look totally different on the outside, we on the inside also look totally different. Our mechanics are totally different. So there's no sense in having everyone do the same thing, or almost the same thing even, if our spines are truly mechanically different on the inside, which they are. Lastly, we get MD referrals. Physicians refer to us because they know and they understand, and they're starting to really understand how mechanics and structure plays a role. And we're the only ones, in terms of CBP, are the only doctors that are making reproducible, repeatable mechanical structural improvements to the spine without drugs or surgery. So what do? Well, is this you? Have you been prescribed medication because of your pain? Have you been prescribed a steroid shot maybe? How about physical therapy? Have you just done the physical therapy and it only seems to make you worse? Maybe you've tried massage. Maybe you've been buying these foam rollers and doing tons of soft tissue work. Soft tissue work has a benefit, clearly. But if this stuff is not going away, I've got to tell you, it's probably because of a hard tissue problem. In other words, a structural problem. How about surgery? Have you considered a surgical consult, or have you been referred to a surgeon? Guess what? So much of the times that's not necessary. The outcomes in general are not really what you're looking for, I assure you. Maybe there's a natural approach. That natural approach is using chiropractic biophysics at Complete Spine Solutions. The next question that you have to ask is there a structural problem with your spine? If there is, all the soft tissue work, all those drugs, they're not going to do anything to address your pain long term. Can that structural problem that you have be significantly improved? We test, we don't guess. And lastly, if that is the case, the only thing to do right now is to take an action step. Here's the action step. Go to our website, CompleteSpineSolutions.com, or pick up the phone and make the call. 404-POSTURE is our number. Do you have a mechanical problem? We'll offer you a free consultation, either in the office or over the phone. Let's figure out what the root cause of your pain and suffering and quality of life or lack of quality of life is. Call today. I really hope you take action, make a move, and get to the bottom of what's really causing your condition. We really want to help you live happier, healthier, stronger, and longer. I'm Dr. Shapiro, Complete Spine Solutions. Have an awesome day.